biggest questions I have is about pigment. Why did I get this spot? What's happening when I get this spot? Now, you look around, we got all different flavors of skin here. Believe it or not, we all have the same amount of melanin. The question is, some of ours is a little bit more overactive. So those of us with color make more melanin, make denser melanin. So you can have some people that have these little light spots on their face. That's just kind of how they're put together. It's not that you did anything wrong. It could be sun damage, it could be genetics, but they'll have, nobody has beautiful even tone and texture except for that girl who lives in Kenya somewhere, that's right at the equator, that has that gorgeous ebony skin. Everybody else, when you look at it, has it uneven tone. So what's happening is we really want to start down here in the basement part of the cells. So this is where we're treating it, so by the time it gets to the surface, i.e. that 30 days, we got even tone and texture. Does that make sense? Okay. So all we're seeing is this thing up on top, and sometimes we can get it with a little chemical peel, sometimes we use lightening agents, sometimes we use agents that turn that over. Hopefully I was able to answer that question. You can get post-inflammatory hyperpigmentation. You get a pimple, you pop it, all of a sudden there's that spot that's left. How long does it take? Usually 2 to 3 skin cycles, or 30 to 60 days, because the skin is constantly turning over. Does that make sense now as far as the time period? The other is, let's say you get an ingrown hair, you tweeze the hair, and all of a sudden there's a spot there. Well, what is that? That's that post-inflammatory hyperpigmentation. Okay? Next question. Are there any creams or topical ointments that really tighten the skin? For example, the crow's feet or the gobble neck. When it comes to that thin layer of skin right here, there are some topicals that do that, but usually what they do is they cause an irritative effect like a light chemical peel, and it helps turn over the skin so that the basement layer can get up to the top layer. Okay, does that make sense? So yes, you can put a hydration on there and it'll kind of plump up, if you will, but it really does not take care of that surface. So usually the creams are like retin-A, retinol, all those vitamin A products that help turn that cell over. And that does improve the crow's feet. It does improve, let's say, the spots, because you're constantly turning the skin over. So yes, there are products that do work in combination with some of the lightening agents. So we've got a lightening agent and we've got a speeding up or turning over agent. Does that make sense?
Would that be why a vitamin C and a retinol would combine?
Let's talk about that. The vitamin C, the way that that works for us is it actually, there is something, vitamin C is called an antioxidant. And what that does is when there's some sun damage going on at the cellular layer, the vitamin C looks like Pac-Man. It gobbles up what we call free radicals, so it doesn't cause damage to the skin. So a vitamin E, a vitamin C, all of those chew up those free radicals from the sun damage that actually happens, and it prevents you from maturing faster than you need to. Does that make sense? The vitamin A just keeps the process just kind of turning over for us. Okay? Next slide. All right. So here is where we're showing how we can actually target pigment by use of a laser. So a laser has a particular wavelength. Not all lasers are created equal. This layer targets pigment. There are other lasers that we use to cut. Okay? This one sends out a particular wavelength. It looks for the target. In this case, it's brown. The brown pigment absorbs the laser and it breaks it up, and therefore the body can gobble it up through macrophages and help blend those in. It's the same process we use for tattoo removal. If I have a black tattoo, I put out a wavelength that's going to be absorbed by the black tattoo. If I have a green tattoo, I switch a wavelength so it gets absorbed by the green tattoo. Does that make sense? And then we kind of break up the big rocks into little rocks, and the body kind of, clears them for us in our normal lymphatic and immune system. Okay? Now everything is a little bit different. This is one showing, how we were able to target that one, how to also use maybe even topicals to kind of help clear that as well. So that spot that's been on your face forever could be sun damage, it could be a hormonal change, it could be post-inflammatory hyperpigmentation. The good news is usually something that we can do to take care of it. Some we do slowly and progressive, and others we can do aggressively. Okay? We just have to see what's going on. Some of you don't want no downtime. You don't want to you want to put your makeup on the next day, so we have to pick a treatment regimen that'll work with you in your schedule. Others say you got 1 week, take it all off, okay? And literally give me a new paint job, okay? And we do that a lot when we're doing facial rejuvenation and things of that nature. By the way, I knew that she'd allowed me to do this, but the pretty lady that you saw walked out that I was clapping for, she actually did a facelift and a chemical peel, and she's only a little bit over a month out, okay? You don't have to look crazy like they do on TV, okay? Next slide. All right, let me get to the next question. Is there any permanent skin tightening besides surgery? Yes, there is. We can use a laser, and I'm going to show you in that case where we use a laser to actually tighten up the skin. The good news is some of them also act like an iron, and there's no laser effect to it. And I'm going to show you the other tools that we have. Now this one is called the microdermabrasion, and usually we can combine that with a chemical peel with Consuela. And we can do progressive ones, or we can put on a Dr. D strength chemical peel. What we're doing is, once again, we're taking that top layer of paint off your car and smoothing it down, and so those bottom layers of paint can get there. It's kind of like washing and waxing the car. For dents, we use filler, we use surgery, okay? But for that washing and waxing, and this is somebody that has about a light to medium peel. Once we put it on, it actually turns white. By the time you get home, it'll be more looking like this. So you're not walking around with like some mask on your face. And then you see over time, what we're doing is just like the vitamin A. We've really sped up that turning over process. It'll almost like the skin will turn a little bit drier brown and then slough off like you had a sunburn. But if you've ever had a sunburn and actually feel that skin underneath, it's tight and it is smooth. That's what we're trying to get to. Does that make sense? You had a question?
How does this compare to the blue U?
Okay, so the question is, and I want to make sure there's a couple of different blue lasers out there. Some blue lasers actually attach or attack acne. And what they do is they prime your face with a particular product, and the bacteria that's usually on your face that causes acne will eat up that product and become sensitized. Then you put the blue light on it and it kills the bacteria. So for those people who have active acne, it cuts that down. There are other blue lasers out there that help rejuvenate the face. So you may have heard the term intense pulse light therapy.
Are the ones with the brown spots supposed to pull all that?
Supposed to pull that. So once again, if it's a laser that has a wavelength that looks at that target, in this case the brown spots, it will work. I think that there's some that do better than others. Sometimes we use those in combination, and sometimes we'll use a CO2 laser, and I'll show you where we just wipe it off. Literally, you'll come in with an A spot, I'll go bzz, 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 wipe it, and it'll be gone. Okay? So we have a lot of tools in the toolbox. Unfortunately, you'll go to places that have one or two tools, and they'll tell you gotta do this. Well, that's the only hammer that they have. The neat thing about having a full med spa, full plastic surgeon, and everything in between is you can choose whatever you want based on time, budget, downtime, and we could probably find something for you. There's not too much stuff that we don't have here. Next slide. So this is, you see that big old age spot over there, right next to her temporal. Literally, that came off in about 5 seconds. Yeah, that's a CO2 laser. You numb it up, or you come up. Some people put numbing cream on before they leave the house. They get here half an hour later. I'll go bzz, bzz, bzz. I'll wipe it off, and I'll go have a good day. You can do this, of course. You can see where she did it on her entire face, where some of the sunspots and the freckles, those are calmed down. Now she still has some. But essentially, they'll go from there. Come on in, join the party. We ain't gonna bust you out like a comedy club. Come on in. But just like church, they're gonna put you right down in front. All right. So this is a huge tool for us. Now, the reason why you don't see a lot of this, that tool costs $150,000. That's a Lamborghini of lasers, and I use this a lot with my facelifts. After we tighten and take out the dents, we want to give it a primo paint job. So this is what we do to do this. Come on in, girl. Yeah, you're going to sit down in the front. We ain't going to sit down. Come on. Come on right here. We'll get the ushers to bring you down. Okay. So that's good. And we're going to answer, and if you have questions afterwards, I will stay here as long as we need to. Okay? How do I get rid of whiteheads on the chin? So let's tell you the difference between a whitehead and a blackhead, okay? A whitehead is essentially a little culmination of, let's say, sweat glands or stuff like that, and it causes that little teeny looking pimple. If for some reason that little pimple, and it has a little seal on it, if for some reason that seal gets broken, you pop it, or overnight it almost would turn a darker color or black, we call it a blackhead. And the only reason is the stuff underneath has been exposed to oxygen, and therefore it gets oxidized and it turns from white to black. That's it. Now, am I a proponent of popping pimples? The answer is yes. Get rid of them. You don't need them. You don't need to wait till they pop. You don't need to wait. Just get rid of them, okay? The more the yucky stuff is out there, the better. So even when you see Consuela and she does your first treatment, a lot of that stuff, think of them as pipes. All that stuff is going to just kind of throw on up. And literally over the next day or two, you're going to like, I'm allergic to this stuff. I'm breaking out. No, that's all of that stuff coming out. And that's what we want to happen. So once you get through that and hang in there, all of a sudden your face is going to feel lighter and things of that nature. Does that make sense? Other questions that we have so far? We're having fun. Yes?
Is that like the ones, like, cause like I have them under my chin and they're little, and I go like that, you can see them.
Right.
And I've had them since, I can't remember when I have not had them.
Right.
And I've had facials and everything, and they just never go away.
Now the neat thing is if you walked in my office, we need to look at them because they may not just be a pimple. They could be something called a cholesterol granuloma. It has nothing to do with your diet, okay? There's these little things that get caught, and some people see them around their eyes, and they can't pop them. And the reason being is they're deeper than you think. Even she can't squeeze them out. I have to get them and either zap them with a little laser or a little electrical surgical thing to open it up, and there's usually like a teeny little white hard seed in there. Once you get them out, you're done, okay? We see them a lot in the Asian population right around the eye, okay? We'll have families come in. And then some of my people of color will not necessarily get those, but those little, looks like, where did all these moles pop up once I turned 35? And it's just genetically predisposed. It's nothing that you did, okay? Stop rubbing your face there. You're fine.
Oh, I know. I
Reflex.
I know. I
You wanna
have
grab
this.
it?